My name is Dr. Ankoor Shah. I'm a pediatrician and the advocacy chair for the District of Columbia chapter of the American Academy of Pediatrics. The DC chapter of the AAP has over 450 members, including pediatricians from all major DC hospitals, federally qualified health centers, and school-based health clinics. I'm testifying today on behalf of the DC AAP and its president, Dr. Lanre Falusi, as well as the Adolescent Health Working Group and its chair, Dr. Krishna Upadhyay. The DC AAP has led a citywide adolescent health working group for the past 3 years, creating an unprecedented collaboration of leaders and experts in local, community-based, governmental, and national organizations, all working together to improve adolescent health in DC. The idea is simple. Preventing teen pregnancy is far more cost-effective than relying on after-the-fact remedies. Therefore, we are testifying to recommend that the district allocate $1.5 million to continue to fund the Teen Pregnancy Prevention Fund Establishment Act of 2014. Under the experience, guidance, and leadership of the DC Campaign to Prevent Teen Pregnancy, the fund supports numerous evidence-based community programs whose work has led to the historic low teen pregnancy rate of nearly 41 pregnancies per 1,000 teenagers. Although teen births have decreased overall in the district, there are still over 650 of them in 2013, with 71% coming from wards 5, 7, and 8. These numbers, these disparities, they're just unacceptable, and continued funding is needed to reduce these numbers. As a sub-grantee of the fund, the DCAP and the Adolescent Health Working Group work towards ensuring that all DC adolescents have access to comprehensive, culturally sensitive contraceptive counseling and access to all approved contraceptive methods, including long-acting reversible contraception, which is effective, easy, and recommended as first line for adolescents. So through the support of this funding, the DCAP Adolescent Health Working Group has acted more as a convener and catalyst for action. For example, we've trained over 100 health practitioners, community educators, family support workers on contraceptives. We've provided medical information and technical assistance to council members and government agencies on health and teen pregnancy prevention issues. We've conducted education and policy symposia, as well as working with local funders to develop citywide family planning initiatives. And we've worked with government and managed care partners to identify solutions on issues such as increasing postpartum LARC utilization. But most importantly, the Adolescent Health Working Group has achieved a remarkable level of cooperation amongst groups who typically work in silos. We've connected people, organizations, institutions, raised awareness, and brought national expertise and technical assistance to local issues. Continued funding under the management of the DC campaign will allow for continued collaboration and progress towards reduced teen pregnancy, particularly in wards 5, 7, and 8. When we think about the largest issues facing the district, homelessness, school dropouts, crime, cyclical poverty, teen pregnancy has a hand in all of them. So I think it's time for us to fight back, time for us to find solutions. And I think continued funding will help just do that. Thank you very much.
Thank you all for your testimony. Dr. Shah, have you received or has Children's received any of the FY16 funding?
So as a part, the District of Columbia chapter of the American Academy of Pediatrics is a sub-funder from the DC campaign. Mm-hmm. We've received from FY15 funds, but not from the
so FY16. From October, from October of last year to now, zero?
So from October last year, we received the funds on June 1st, and the District of Columbia chapter of the American Academy of Pediatrics had $100,000 from that we're using.
Okay, so let me roll back.
Yeah.
So from FY15 you received. So yes. FY16
we have not received, and we're not.
Have you applied for?
So, and I could get back to you on more information. We are not 100% sure if the DC campaign has received the funds yet for us to apply for the grant for FY17.
No, for FY16.
Yes.
Even though it should have been available since October, you have not received any.
No, we're still using the funds from the previous year that we got.
Well, Brenda Rhodes Miller is coming up next, so I can ask that. I just wanted to say, so for the most, that was all. I really don't have any questions, because I definitely introduced and support the legislation, but I just want to ensure the funding is where it needs to be for that. And for the report card, keep up the good work with that. Or I guess we should keep up the good work with that, right, the city. Thank you all for your testimony.
Thank you.